Have you ever wondered what really causes gout? The answer might not be what you think. Gout, a form of arthritis, has been misunderstood for centuries. It's a condition that has plagued humanity for a long time, affecting an estimated 8.3 million people in the United States alone. Predominantly, it is males over 40 who are most affected, but gout does not discriminate. Notable figures in history, such as Leonardo da Vinci and Benjamin Franklin, were also known to suffer from this painful condition. Gout is characterized by sudden, severe attacks of pain, redness, and swelling in joints, often the joint at the base of the big toe. It's been likened to the severity of childbirth pain, and it's not hard to see why. Imagine a sharp, needle-like crystal depositing itself in your joint. That's essentially what's happening during a gout attack. This painful condition is caused by an excess of uric acid in the body. Uric acid is a waste product that's created when the body breaks down purines, substances found in your body and in certain foods and drinks. When produced in excess or not excreted adequately by the kidneys, this uric acid can crystallize in the joints and trigger a gout attack. Diagnosing gout involves a few steps. Physicians may extract fluid from the affected joint to look for uric acid crystals, perform blood tests to measure uric acid levels, or use imaging tests such as X-rays to identify uric acid deposits. Now you might be thinking, isn't gout just caused by eating too much meat or drinking too much beer? While it's true that diet can contribute to gout, it's only part of the story. About 2/3 of uric acid production comes from within our own bodies, and only 1/3 comes from our diet. Despite popular belief, the cause of gout goes beyond just diet. It's a complex condition with various causes and triggers, and understanding it is the first step towards managing it effectively. So let's dive deeper to uncover the truth about gout. Is gout just about what you eat? Let's hear it from Dr. Kim, our resident expert. Let's debunk a common myth. Many believe that gout is solely a result of indulgence, a punishment for those who overeat rich foods. However, the reality is far more complex. Yes, diet plays a part, but it's not the leading actor. The real culprit? The overproduction of uric acid by the liver and its inadequate elimination by the kidneys. Now you might be wondering, what is uric acid? To put it simply, it's the waste product left when the body breaks down purines, substances found in our cells and in certain foods. When the body produces too much uric acid, or fails to eliminate it efficiently, it can build up, form crystals, and settle in the joints. This is what causes the intense pain associated with gout. While diet contributes to uric acid levels, it's not the only factor. In fact, only about 1/3 of uric acid production comes from diet, while a whopping 2/3 is endogenous, meaning it's produced from within the body itself. This means that even if you ate the exact same diet as someone else, your body's unique metabolism and uric acid processing could mean the difference between suffering from gout or not. Did you know that gout affects around 8.3 million people in the US alone? It's not a new condition either. Some of history's most celebrated figures, like Leonardo da Vinci and Benjamin Franklin, also suffered from it. Predominantly, it affects males over the age of 40, but anyone can fall prey to this painful condition. Symptoms of gout include severe joint pain, redness, swelling, and the formation of tophi, which are deposits of uric acid crystals. Diagnosis can be made through fluid extraction from the affected joint, blood tests for uric acid levels, and imaging like X-rays. So it's not just about what we eat, but also about how our body processes uric acid. Let's remember, while diet is a piece of the puzzle, it's not the whole picture. We must consider the role of our liver and kidneys too. Understanding this can help us finally experience food freedom from gout attacks. Now that we've debunked the dietary myth, let's delve deeper into understanding uric acid. What is uric acid, you ask? It's a byproduct of cell metabolism. When our bodies break down purines, substances found naturally in our cells and in certain foods, uric acid is produced. Usually, it dissolves in our blood, passes through our kidneys, and leaves the body in our urine. However, if your body produces too much uric acid, or if your kidneys aren't excreting enough of it, it can build up in the blood. This buildup of uric acid can lead to sharp, needle-like crystals in a joint or surrounding tissue that cause pain, inflammation, and swelling, the telltale symptoms of a gout attack. Imagine millions of tiny needles jabbing into your joints, causing intense pain. This is the reality for those suffering from gout. Now, uric acid is not entirely villainous. It's important to differentiate between endogenous and exogenous uric acid. Endogenous uric acid, which accounts for about 2/3 of the total uric acid in our bodies, is produced internally as a byproduct of DNA and RNA metabolism. It actually serves a crucial role as an antioxidant, protecting our cells from damage. On the other hand, exogenous uric acid, which makes up the remaining 1/3, comes from our diet, particularly from purine-rich foods and drinks. If we consume too much of these, our bodies may produce more uric acid than it can handle, leading to the painful symptoms of gout. So it's a delicate balance. We need uric acid for its antioxidant benefits, but too much can lead to gout. It's not just about what we eat or drink, but about how our bodies produce and eliminate uric acid. The irony is that uric acid, a substance that's naturally produced by our bodies and serves a protective role, can turn against us, causing debilitating pain. But this understanding gives us a better chance of managing gout effectively. Understanding uric acid is the first step towards managing gout effectively. So, how can we tackle gout? Let's learn from Dr. Kim's vast experience. Dr. Kim, with his 30 years of experience in holistic podiatry, provides us with some crucial insights into managing gout effectively. He emphasizes the importance of not just focusing on the diet, but also on the body's overall balance. It's about harmonizing the body's acidity and alkalinity, inflammation, and the production and elimination of uric acid. So how do we achieve this balance? Dr. Kim suggests the process of alkalizing the body, which essentially means increasing the body's pH, making it more alkaline. This can be done through the consumption of alkaline foods and drinks, and reducing the intake of acidic substances. Some simple ways to alkalize the body include drinking celery juice or lemon water, consuming cherries, or even using baking soda. In case of an emergency, such as an intense gout flare-up, Dr. Kim recommends taking potassium citrate tablets. These tablets can help to rapidly increase the body's alkalinity, providing some relief from the debilitating pain. Aside from alkalizing the body, another significant aspect of gout management, according to Dr. Kim, is reducing the consumption of high purine foods and drinks. Purines are substances found in certain foods and drinks, such as red meat, seafood, and alcohol, particularly beer. When these purines are metabolized in the body, they produce uric acid. By limiting the intake of these high purine substances, we can control the amount of exogenous uric acid coming from our diet. It's important to remember that while these measures can help manage gout, they are not a cure. Gout is a chronic condition, and managing it requires a comprehensive approach that includes diet, lifestyle modifications, and sometimes medication. But the good news is, with Dr. Kim's insights into effectively managing gout, you can finally experience food freedom from gout attacks. There's no need to live in fear of your next meal triggering a painful flare-up. With understanding and balance, you can enjoy your food while keeping gout under control. With these insights, you can finally experience food freedom from gout attacks. In summary, gout is more complex than just a rich man's disease. This painful condition, often likened to the severity of childbirth pain, is not solely caused by diet, but significantly influenced by the overproduction and inadequate elimination of uric acid in our bodies. We've debunked the common myth that gout is merely a consequence of indulgent eating. Instead, we've highlighted the primary cause of gout, the overproduction of uric acid by the liver, and its insufficient elimination by the kidneys. We've delved into the world of uric acid, a byproduct of cell metabolism that crystallizes in our joints, causing intense pain. We've learned that about 2/3 of uric acid production comes from within our bodies, while 1/3 comes from our diets. We've noted that gout is not a selective condition. It affects approximately 8.3 million people in the US, predominantly males over 40, but it doesn't stop there. Even historical figures like Leonardo da Vinci and Benjamin Franklin were not spared. We've recognized the symptoms of gout: severe joint pain, redness, swelling, and the formation of toffee uric acid crystal deposits. We've also looked at how gout can be diagnosed through fluid extraction from the affected joint, blood tests for uric acid levels, and imaging like X-rays. We've understood that there are two types of uric acid: endogenous, produced internally as a byproduct of DNA-RNA metabolism and acting as an antioxidant, and exogenous, coming from our diet, including purine-rich foods and drinks. Finally, we've heard from Dr. Kim, a holistic podiatrist with over 30 years of experience, who suggests alkalizing the body with emergency potassium citrate tablets, baking soda, celery juice, lemon, or cherry intake. He also emphasizes the importance of reducing the consumption of high purine foods and drinks. By addressing the real cause, we can finally free ourselves from the painful shackles of gout.